This is Victoria. She's 35 and has been drinking a bottle of brandy a day.
Tender.
It's not soda, it's tender.
Matthew's 45. 20 pints a day left him needing a liver transplant.
When Mr. Richardson had said to me, Matty, you're dying, I cried my eyes out.
And Brian's 32. He drank so much cheap cider, he ended up living in a cave.
Grim place, isn't it?
This just looked like a normal home to me when I was drinking.
They're part of a new, younger generation of problem drinkers.
We are seeing people as young as those in their 20s dying of alcoholic liver disease.
Tonight, Panorama gets rare access to a hospital that's seeing the impact of drink on every ward.
Worst case scenario is it will kill you.
And we ask, are the government doing enough to stop us drinking ourselves to death?
Saw you a while back, didn't I?
I can't remember.
Yeah, she was. So let's get that done today.
It's Friday morning at Liverpool's biggest hospital, the Royal.
Make sure she gets her blood, so make sure she's seen by. Okay, who do we have in here?
Liver specialist Paul Richardson is on his ward round. One of his patients is worrying him.
She's still tearful.
Her name is Victoria White.
Morning. Hi.
Victoria's only 35. She's got 2 children. But she's been drinking heavily since she was a teenager. And this is her today.
Some people go the separate way from alcohol. I didn't. I just carried on with it. You're just selfish to drink. As long as you're all right. You just don't care. You really don't care. You don't get me wrong, my kids were clean and, you know, clothed and stuff like that, but that's besides the point. They need a mother, not a drunk.
Her eyes are yellow because her liver's failing. And Victoria's been here before. She nearly died 5 years ago and was told to stop drinking.
It was okay at first. I'd just have a couple and leave it. And then as the days went to weeks, just started drinking again and again and again. And here I am today. Just ruined by this substance that I pour into my body.
And her mother, Debbie, has watched drink slowly take over her daughter's life.
When she was about 16, she started lying, saying she hadn't had a drink, but you could smell it on her, you could tell. We started finding then like cans of cider, bottles of vodka in her bedroom. She'd hide them under her bed. It was very heavy drinking. It wasn't like a few glasses of lager. It was like bottles of vodka, bottles and bottles of cider.
Morning.
And all that vodka and cider has left Victoria very ill. The doctor has serious concerns. He decides to take Victoria's mum away for a chat. What Debbie hears now is every parent's nightmare. Off camera, she's told her daughter is getting worse. She might not make it.
She's a lot worse than us. With some of the treatment, we might see some improvement in the kidneys and stuff, but I said I'm very, very concerned about it this time. I'd have expected to see improvements by this sort of stage of a hospital stay, and unfortunately I've not seen the sort of progress that I would like to.
Alcoholic liver failure is what used to kill old men. Now it also kills young women. Paul Richardson says about 2/3 of his cases are alcohol-related, but it's the trend that is most disturbing. Cases of alcoholic liver disease in the under-30s have risen by half in the last 10 years.
Both locally and nationally, people who are working in the field of hepatology have noticed an increase in alcoholic liver disease, and particularly alcoholic liver disease in a younger generation, or a younger population, should I say.
We are seeing people as young as those in their 20s dying of alcoholic liver disease, end-stage liver damage from alcohol. Now, that was just not seen 30 years ago.
So how did it come to this, with alcoholic liver disease rising so dramatically and affecting younger and younger people? Well, experts say it's down to our national addiction, drink. It's everywhere, it's cheap, and millions of people are drinking too much. From happy hours to supermarket deals, alcohol is hurting the nation's health.
It's costing the health service about £2.7 billion a year, and in fact about 9 million people are affected by the harms that alcohol causes, so it's a big problem.
It's not just words and statistics. This is what we saw one Friday night in the Royals A&E. We're in Liverpool, but this could be anywhere.
He's been out tonight and he's had at least half a bottle of vodka, has been found sleeping on the floor, and his friends have gone home and left him. This young lady that's just come in has been found lying in the street by police, totally by herself, no one with her, has been drinking a lot tonight, said at least a bottle of vodka. It is only 1 o'clock, so you never know what's going to come in.
The young in here have grown up in a new drinking culture, a generation that's only known cheap, readily available alcohol.
Drinking tonight? Yeah. She's been out tonight and she's had quite a lot to drink, she says, a lot of vodka, and she's ended up in Sefton Park and doesn't know how she's got there. Have you been out tonight? Yeah?
Well, basically my brother Paul had a fall this evening after a few drinks, one too many. Hit the wrong curb and went over.
It can look comical, but the scale is terrifying. A quarter of the adult population drinks too much.
Like my birthday, I had about 4 or 5 pints for my birthday.
We've got the problem of, if we've got a lot of people intoxicated by alcohol in the cubicles, we've got nowhere then to see patients that need to be assessed and things like that.
It's very difficult to know why our culture has changed so radically, but all the international evidence suggests that the big drivers for the amount people drink, the amount populations drink, are the price, the availability and the marketing. And that's where we've been trying to push governments to look at their policies.
It's in areas where they're not allowed to do that.
But how much influence can politicians have on our national drink problem? Well, our Prime Minister has strong views on cheap alcohol and the consequences of drinking too much.
And this is the stuff you're talking about. Frosty Jacks, that is 3 litres, 5.28 pints.
7.5.
7.5, and what would that cost me?
You can get that for £1.99.
£1.99. You drunk that lot, £1.99, you'll be completely smashed. The police lifted off the streets, people drinking.
In opposition, the Conservatives were clear that price was an issue. Their manifesto said ban off licences and supermarkets from selling alcohol below cost price. Before coming to power, the Conservatives set up a health commission to find a new way of dealing with public health problems. Invited onto the panel were those who make and sell alcohol, sitting alongside health professionals. One of those invited was Simon Capewell, a professor of public health at Liverpool University. He joined because he thought everything was up for discussion, but he says that's not how it really worked out.
Every time effective interventions were discussed, legislation, regulation, taxation, subsidies for healthy options, there was a polite nod, and then we moved on to the next item. And of course, when we got to drafting and finalising the report, all of these, the most effective interventions, were notable by their absence.
But in power, the coalition government clearly thought this more consensual approach was a good idea. They called in the drinks industry and the health lobby. So in theory, this would bring all of the interested parties together, the drinks industry and the health lobby, with the government listening and brokering a way forward. All sounds good. The companies that make and market alcohol were represented, as were the supermarkets. A number of health and pressure groups were there too. But once again, the allegation is real change was not on the agenda.
We've put forward the suggestion that the supermarkets should not stack huge mountains of alcohol in the front of their stores. We put forward a suggestion that we should have health warnings on alcohol adverts, that supermarkets shouldn't advertise on the basis of price. All of these suggestions from the health organisations were met with complete stone silence.
The health lobby also claimed that the crucial issue of pricing was off limits.
Every alcohol expert in the world looking at the health issue, World Health Organization down, will tell you pricing and availability are two incredibly important planks. So being told that they were off the table was extremely worrying.
They were so concerned by what they saw and heard that in March of this year, many groups, including the British Medical Association, decided to withdraw from the consultation process.
I think it's a tragedy. I think it's so sad because the goodwill from the health lobby is enormous.
The health lobby stopped talking to you because they just felt you were way too close to the drinks industry. That's what they say. They wrote to you and told you that.
I'm really sad, actually, that people stopped talking to us because it's never productive. We have to talk to people that we disagree with, but it's really important because actually when you look at public health, and alcohol is a public health issue, what we need to do is to employ every tool in the box, and everybody has got a part to play.
Now, since coming to power, the government has increased the tax on super-strength beer and has taken the first steps towards banning drinks being sold below cost. But the main policy document, the delayed alcohol strategy, is now expected by the end of the year. So right now, the government's deciding just how far it should go to tackle our excessive drinking. The problem comes with who it chooses to listen to. For many of those on the front line at the Royal, any solution would need to be dramatic. They see a problem that's moved a long way from just Friday nights. Even Tuesday lunch is dominated by booze.
This is really common. Like they say, at least at peak times, 70% of A&E presentations are alcohol related in some way, whether it's indirectly or directly.
Kelly's 29. She's here with her younger brother. They're both drunk. He's being treated for a cut.
I had a few, 2 bottles of vodka and a case of lager. You know, it was my birthday on Saturday, so we just carried it on.
Kelly's brother David gets back and explains the drunken game that led to his fall.
Swung round the lamppost, hit the lamppost, but missed my foot and ended up on my chin. It was like a blood shower.
And we're still going for a pint now, aren't we? Yeah, we're just going to go and get a pint and a pack of crisps. Good day.
Overall, alcohol consumption is actually falling, but in our hospitals, alcohol-related admissions continue to soar. Last year, for the first time, there were more than 1 million. Alcohol admissions have doubled in a decade. And every single case has a big impact on our health service.
The average inpatient costs £400 a day. So this unit at the Royal is an attempt to reduce those admissions.
It's still a little bit shaky. Yeah.
Lynn Owens runs a team that works across the hospital with the thousands that come here with alcohol problems.
Most people would imagine